Hello, my name is Husain Borki. I am second year medical student. What's your name?
Murtuza.
Okay. And what's your age?
50 years.
Okay. Today we will be examining your nervous system, sensory system and reflexes. Is it okay?
Okay.
Okay. Let's proceed. Now I am going to poke you with this swab. You have to tell me which end was it. This is the sharp end and this is the dull end. Now you close your eyes. Okay.
Sharp. Sharp. Dull. Sharp. 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 Dull. Sharp.
Okay. I have a hot spoon and I have a cold spoon. You have to tell me with your eyes closed that from which spoon you have been touched. Okay?
Okay.
Okay, close your eyes.
Hot. Cold. Hot. Cold.
Okay. Now I am going to touch you with this cotton swab. You have to close your eyes and when you feel it, say now.
No. No.
Okay.
Use a relatively low-pitched tuning fork of 128 Hz, tap it on a surface and place it firmly over a distal interphalangeal joint of the patient's finger, then over the interphalangeal joint of the big toe. Ask what the patient feels. If you are not sure whether the patient is feeling pressure or vibration, ask the patient to tell you when the vibration stops.
Now with your eyes closed, you have to tell me to which direction I have moved your toe. Okay?
Okay. Up. Down. Left. Right.
Okay. Now with this.
Up. Right. Down. Left.
Okay. Nice. Now same with your fingers. Ready?
Okay. Up. Down. Right. Left. Up. Left. Right. Up. Down.
Okay. Now I'm going to write numbers on your palm. With your eyes closed, you have to identify which number was it.
Okay.
Okay? Let's start.
Five. Two. 6.
Okay.
8. 7. 1.
Okay. Now I'm going to poke you with this pins. You have to tell me how many pins were there. Okay? Let's start. Give me your hand. Close your eyes.
2.
Okay.
2. 1. 1. 2.
Okay, nice. Now I'm going to touch you with my finger like this, and you have to tell me where have I touched you.
Okay.
Okay. Now close your eyes. Okay.
This.
Close your eyes.
This.
Okay. Close your eyes.
This.
Okay.
Here.
Okay.
Here.
Now I'm going to touch you with my two fingers on your both sides. You have to tell me, have I touched you only on one side or on both sides? Okay? Okay, close your eyes.
One side. Two side. One side. Two side. Two side.
Okay.
The patient's elbow should be partially flexed and the forearm pronated with palm down. Place your thumb or finger firmly on the biceps tendon. Aim the strike with the reflex hammer directly through your digit towards the biceps tendon. Observe flexion at the elbow and watch for and feel the contraction of the biceps muscle. Flex the patient's arm at the elbow with palm towards the body and pull it slightly across the chest. Strike the triceps tendon with a direct blow directly behind and just above the elbow. Watch for contraction of the triceps muscle and extension at the elbow. The patient hand should rest on the abdomen or the lap with the forearm partly pronated. Strike the radius with the point or flat edge of the reflex hammer about 1 to 2 inch above the wrist. Watch for flexion and supination of the arm. The patient may be either sitting or lying down as long as the knee is flexed. Briskly tap the patellar tendon just below the patella. Note contraction of the quadriceps with extension at the knee. Placing your hand on the patient's anterior thigh, let you feel this reflex. Supporting both knees at once allows you to assess small differences between the two knees. When the patient is lying down, flex one leg at both hip and knee and rotate it externally so that the lower leg rests across the opposite shin. Then dorsiflex the foot at the ankle and strike the Achilles tendon. Support the knee in a partly flexed position. With your other hand, dorsiflex and plantar flex the foot a few times while encouraging the patient to relax. Then sharply dorsiflex the foot and maintain it in dorsiflexion. Look and feel for rhythmic oscillation between dorsiflexion and plantar flexion. Normally, the ankle does not react to the stimulus. There may be a few clonic beats if the patient is tense or has exercised.
You may feel uncomfortable. Okay. Okay.
Test the abdominal reflexes by lightly but briskly stroking each side of the abdomen above T8, 9, 10 and below T10, 11, 12. The umbilicus. Use a key, the wooden end of a cotton-tipped applicator or a tongue blade. Twist it and split longitudinally. Note the contraction of the abdominal muscle and movement of the umbilicus towards the stimulus.
We have completed your examination of sensor system and reflexes. Thank you for cooperating, Murtuza.
Okay, thank you.